if you have to have a mole removed and you think it's cancerous, it's covered if it is cancer, and it's not covered if it isn't.
And we get some horrendous stories of elderly people, particularly who are addicted to morphine. And you can actually get services for your addiction to morphine, but you can't get the surgery to cure the problem, so you don't have to take the morphine. 75 or 80% of the money that's put in by the governments goes to infrastructure, administration, and labor costs, and only 20 to 25% actually goes to patient care. That is the biggest difficulty in reforming the system, is that the unions, there is dozens of healthcare unions, and the administration is also unionized. So you have people that are controlling that system and make it extremely difficult for any reform-minded politician to make any meaningful changes.
One day after a major health employee union strike, the wait list for surgeries had become so unmanageable that the government started funding the hospitals to outsource some of their daycare procedures to some of the local private clinics, which are still only allowed to do daycare procedures. They're not allowed to admit people over 24 hours in the hospital.
Healthcare strikes. The pressure on the politicians to resolve that immediately is incredible. And well, how does a politician resolve something? Simply by putting more money on the table or by caving into union demand. So it makes it very difficult to turn the ship and to do something different, because you've got to deal with that infrastructure and those labor contracts that you already have in place.
If I'm hurting, again, I'm back to the waiting game, and whatever they say goes.
It is like turning the Titanic. When you sight the iceberg, it's very difficult to do, and as to date there hasn't been a Margaret Thatcher who's willing to take on the problem head on.